Hello, my dear friends. We will discuss a very important topic today, tuning fork test. Uh, Tuning fork test is basically the test for assessment of hearing clinically. Uh, in tuning fork test, we can't exactly tell about the how much hearing loss is there, but we can tell which type of hearing loss is there. Either it's a conductive or sensory neural hearing loss. First, before going to on for the details of the tuning fork, we first will discuss the parts of the tuning fork. Here we look at the tuning fork. This is a tuning fork. The parts of the tuning fork are these are the prongs of the tuning fork. This is the shoulder of tuning fork. This is the stem, and this is the base or foot plate of the tuning fork. The commonly used tuning fork in ENT is 256 Hz, 512 and 1024 Hz. But we commonly use the tuning fork of 512 Hz. The tuning forks of lower frequency produce the sense of bone vibration. That way we don't use. And tuning fork of higher frequency produces the have a shorter decay time. That's why we don't use. In tuning fork test, basically we test the air conduction and the bone conduction. The air conduction basically tells about the both conductive pathway and the function of the cochlea, and bone conduction basically tells about the cochlear function. There are tuning fork tests are Rhenish, Weber, absolute bone conduction test, Shopak test, Bing, Gallis, Stangus test, Chimani-Moose test. These are the different tests of tuning fork test. Basically, the Stangus test and Chimani-Moose test used for the differentiating between the functional or organic hearing loss. First, we will today just discuss the about the air conduction and bone conduction. The air conduction is tested by placing the tuning fork in front of EAC from 2 cm from the EAC, and the prong should be like that, because the direction of vibration should be like that. And for testing of the bone conduction, we place the tuning fork on the mastoid tip. The procedure for this testing air conduction, first the tuning fork is charged. Ideally the charging surface should be a rubber pad, but we can use the any bony surface or shoe of the sole of the shoe by striking the tuning fork at the junction of anterior 1/3 and posterior 2/3, because there is a maximum vibrations are there. So we will discuss each test one by one. First we will go with the Rhenish test. In Rhenish test we compare the air conduction with the bone conduction. There are two methods for testing for the Rhenish. First, we can charge the tuning fork and place on the mastoid. When patient stops hearing, it places on the in front of EAC. If patient is still here, this means air conduction is more than bone conduction. Or second method, we can place the tuning fork on the mastoid when patient stops hearing, and again charge and place in front of EAC and ask the patient which sound is louder. In Rhenish test, normally the air conduction is more than bone conduction. But if air conduction more than bone conduction, there are two possibilities: either it's normal or sensory patient of a sensory neural hearing loss. Basically, these indicate the positive Rhenish test if air conduction is more than bone conduction, and if bone conduction is more than air conduction means Rhenish is negative. Then the second test is we go for the Weber's test. In Weber's test, we test the bone conduction. We tell the patient, we place the tuning fork, charge the tuning fork and place on the forehead, vertex or teeth, and ask the patient sound is heard equally on the both side, or sound is which side you heard louder. Normally the patient is heard equally on the both side. In cases of conductive hearing loss. The sound is lateralized towards that ear, and because patient hears better on that side, because conductive pathway is blocked, so patient totally the bone conduction is working better, so the patient hears better on the disease side. But in cases of sensory neural hearing loss, because here the bone conduction is defective, so the waiver is lateralized to the normal side. The third test is absolute bone conduction test. In this absolute bone conduction or ABC test, we also test the bone conduction, and we compare the bone conduction of patient with the examiner. Examiner can be anyone who has an oral hearing sensitivity, and first we charge that in this ABC test, the procedure is we charge the tuning fork and the place on the mastoid, and the tragus of the patient is closed, and so the ambient noise cannot be interfered. Normally, if there is a patient have a conductive hearing loss, if patient has conductive hearing loss, the conductive pathway blocked, so if you block the EAC, there is no effect on the hearing of the patient. But patient have a sensory neural hearing loss, or normal patients, they hear for the, because the bone conductor pathway is defective, so they hear for the shorter duration. If the patient and the examiner hear for the same duration, it is called as a same as examiner. And if the patient hears for the shorter duration, it indicates patient have sensory neural hearing. Similarly, we do the Schaubeck test, but in Schaubeck test we don't include the EAC, and similarly like absolute bone conduction test. In Bing test, we test, and this also we test the bone conduction of the patient and see the effect of occlusion of EAC on the hearing. When we charge the tuning fork placed on the mastoid process and open or close the EAC of the patient with the help of pressing tragus, and see the effect of hearing. If patient have on the closing, on closing the patient hears louder, normal patient hears louder. If the patient have a sensory neural hearing loss, then the patients also hears less here, because the bone conduction pathway is defective in this test. And the last test is the Galley's test. In Galley's test, we also test the bone conduction of the patient, and in past we used for this test used for the diagnosis of the otosclerosis, but presently we not use for the diagnosis of it, because we have a tympanometry and other test for the diagnosis of the otosclerosis. So the tuning fork is charged and placed on the mastoid process, and continuously increasing the pressure in the EAC with the help of the opening of closing the tragus, or with the help of the pneumatic column we can change the pressure in the external auditory canal. If we change this pressure goes into the tympanic membrane oscles and goes into the inner ear fluid and the basilar. When these vibration goes into the pressure goes into the inner ear, it causes neural fluid changes. The basilar membrane becomes immobile, and the patient have a reduced hearing sensitivity. This happens in the normal cases. If suppose the patient's stapes polity is fixed, then there is no effect on the hearing, because the further vibration cannot transmit it beyond that, so the patient have no change if the stapes polity is fixed. And the other tests like a Stanger's test and the Chimani-Moons test. These tests are used for the differentiating between the patient have a true hearing loss or the patient is malingering. In Stanger's test, we took a two tuning fork of the same frequency and strike and place at a 8 cm distance from the both ears, and patient is blindfolded and ask the patient to hear. The patient says it's hearable in the audible in the normal ear, but in the defective ear not audible. Similarly, again we charge the tuning fork, and on that side the patient have a hearing loss. We close the tuning fork of that side to the 4 centimeter, and on normal side the tuning fork on the same distance, and ask the patient, then tell how the hearing is there. The patient said he can't hear anything. Means the patient, if the patient has a normal true deafness, then the patient says the patient will not hear on that side. But the patient in blanking, he says he cannot hear anything. But normally the patient can be heard on the, because we don't change the distance of the tuning fork on the normal side, we place at the same distance. And in Chimani-Moose test, basically Chimani-Moose test is also, it's a modification of the Weber's test. In this test, patient is blindfolded, and we place the tuning fork on the forehead and ask the patient to which side is lateralize this tuning fork test. The patient says on the deafness side this lateralize better, on that side of the test. But we don't use this test nowadays because we have a further audiometric test for differentiating between the organic hearing loss or functional hearing loss. So with this type of test, tuning fork test, we can tell the which type of hearing loss is there, but exact value we can't tell on the basis of this tuning fork test. For we need a audiometric test, they can tell about the how much degree of hearing loss is there. So this is all about tuning fork test. In next lecture, we will discuss about the pivot tone audiometry, because it's a very important topic for the undergraduates and also for the postgraduate students, because many questions comes in the PG exam, and also for the undergraduates there is a spot questions in final third year exam, viva or on the table viva or in the spotting is 1 or 2 question is there. So it's a very important, we will discuss. I hope you will understand what I told you. If you have any query, you can message me on my comment box or on my email ID given on that